Implants for dental purposes have grown to be an increasingly popular choice to replace missing teeth as well as making smiles come back. Implants are a long-lasting solution that will enhance the look and functionality of the teeth. If you're thinking of getting dental implants, you need to know the procedure and the expectations. In this short video, we'll provide an easy-to-follow guide that will guide you through the procedure of receiving dental implants. 1. Consultation with the dentist. The initial step to get dental implants is scheduling an appointment with the dentist. In this consultation, the dentist will look at the gums and teeth as well as take x-rays and talk about your options for treatment. The dentist will also assess the health of your mouth and decide whether you're a suitable implant candidate. Step 2. Treatment planning. After the dentist has assessed the health of your mouth and concluded that you're a suitable candidate for dental implants, they'll develop an individual treatment plan that is tailored to the specific requirements of your. The plan will outline the amount of implants required and the location of implants, as well as any other procedures that might be required, like dental grafting or bone grafting. Step 3. Implant placement. The following step of the procedure is placing of the dental implants. The procedure is usually carried out in a series of stages. In the initial stage, the dentist surgically inserts tiny titanium posts in the jawbone. The post is used as the base of the implant. Once the implant is in place, the post will require some time to heal and become integrated into the bone. This is a process called osseointegration. Step 4. Healing and integration. Once the implant is in place, after the implant has been placed, it is important to give time for healing process and the integration to occur. It usually takes a few months. In this period, bones will develop around the implant and secure it and forming a solid base for the implant. Step 5. Abutment placement. After the implant has completely formed and bonded to bone tissue, the following procedure is to attach the abutment. It is a tiny part that connects the implant post and the tooth that is made. It's attached to the post of the implant and acts as a support for the denture or crown, which will be bonded on the implant. Step 6. Crown placement. The last step of the procedure is the placing of the denture or crown on the attachment. The custom-made crown will fit the size, shape, and shade of your teeth naturally, giving you a natural and seamless outcome. After the crown has been bonded to your implant, it is completed, and you are able to enjoy your brand beautiful new smile. The bottom line is that the process of getting dental implants can be a complex procedure that requires meticulous preparation and coordination between your dental professional. If you are aware of the various steps when you are considering dental implants, you will be able to make educated decisions regarding your dental treatment and have a stunning and healthy smile. If you're considering getting dental implants, you should consult an experienced dentist who can discuss the options available and develop an appropriate treatment plan suitable for your needs. If properly maintained and cared for, dental implants will provide lasting results that will improve the quality of your living.